Try and run this a lot faster. The next section is imaging and treatment of neuroendocrine tumors. The first speaker is Dr. Mariel Fortier, who's my good colleague from the hospital. Mariel is a radiologist who does a lot of ultrasound and MR for us. She's excellent, and she just came back from, she's got a bit of a tan, she just came back from the Far East doing talks, and she's going to talk on CT, MR, and ultrasound. And Mariel?
If I seem a little lost and spacey, it's because I'm still in a different time zone. I've just come back from Cambodia and Singapore, so I'll try to, I guess, make this a very focused talk, and hopefully you can enjoy it. I'm going to be dealing with diagnostic imaging of predominantly abdominal carcinoids, and give you some insights in terms of what we look at in terms of imagers. Let's see if I can. In terms of the current modalities that are available to me, to patients and their physicians, we can certainly consider ultrasound, CT, and MR. Now, ultrasound is a great modality in the sense that there's no radiation. It's fairly easy for the patient, but it has limitations. And one of them is that it's a very focused exam, and it's very operator dependent. In other words, the skills of one sonographer may not be the same as another. So that's something to bear in mind. CT is definitely one of the imaging modalities of choice in terms of carcinoid and neuroendocrine tumors. And the reason being is that that is often done in a very standard way, reproducible, and also very effective in terms of looking for particularly metastatic disease. MR is our latest thing that we've added, and it is great at picking up, well, perhaps not the primary tumor, but certainly metastatic disease. Reason being is that it has what we call increased soft tissue contrast. And I'll show you some examples so it kind of will make sense to you. In doing this talk, I've decided that I would marry some travel images with diagnostic images. And the reason being is that I think it'll help you in terms of recognizing what we do as imagers. I'm going to show images or photos from two Buddhist kingdoms from across the world. And you're going to be able to see from the images in terms of the location, some of the history. So that helps to diagnose where these kingdoms are and what's happening. All right, so here we have beautiful scenery, nice valley, some mountains in the background, and some prayer flags. I'm not sure if I'm going to be able to use the pointer here. You can see in the background, sorry, try not to blind somebody. There we go. You can see that the prayer flags again, and this particular type of building called a zong. So now we're going to go through some typical cases, all right? So what we have here is a CT scan. It's done in an axial way, which means it's like slicing across somebody. And what we see here is the primary tumor in the right lower quadrant. It's actually part of the small bowel. And then there's this mass within the small bowel mesentery, and this mass has these little bright areas that are actually calcification. So this is a carcinoid in the terminal ileum that has gone into, well, spread nodal disease in the small bowel mesentery. Another feature of this is that I'm not sure if you'll appreciate, but there's a little bit of stranding around that mesenteric mass, and that's something we look for because it's called desmoplastic reaction. It's like scarring. It draws things in. This person, at the time of presentation, also had liver lesions. You can see these. Feature of these liver lesions with carcinoids is that in terms of when we give the contrast, you can see that it's very brisk and they enhance very rapidly, which helps us distinguish liver metastases from a carcinoid from, let's say, liver metastases from a colonic adenocarcinoma. Okay? So these are features that help us in terms of the diagnosis. Other things that happen with the diagnosis then in terms of dealing with the metastatic disease, one thing that is done at our center is chemoembolization, and this individual underwent that. And I'll leave it to my colleagues who do angiography to best explain that. That's out of my realm. But just to show you in terms of what I see after embolization, we can see that there's quite dense material. It appears as white. It's lipiodol. And it tells me the territory that the agent was sent into the liver. So that's what it was like in December 2007. You see it's the territory of the left liver. By January, that had totally washed out. And what was interesting is that, of course, the liver lesions here are reduced in size or not conspicuous, but we still see small lesions in the right lobe. This patient then underwent chemoembolization of the right side to deal with the right liver lesions. And that's the day after that particular treatment, where you see the lipiodol in the territory, and also you see the lipiodol taken up in several of the liver lesions. So now we're back to the travel. Beautiful valley, and I'm not sure if you can see it, there's terracing, and this is actually the rice fields, and they're done in the farming is done in a terrace fashion. And I can tell you that this is actually part of the Himalayas. This is the highest peak in the eastern Himalayas, nowhere close to Mount Everest, but it gives you an idea where this Buddhist kingdom is. Just a few more examples to highlight in terms of what we can do for imaging for carcinoid and neuroendocrine tumors. See here that we have some staples here. The surgery was done here. This patient also had the mesenteric mass, and you can see that reaction again. And it's leading to what we call tethering of small bowel. So something that can accompany the mesenteric mass. We can see that the metastatic lesions in a fatty liver. Why do I make that comment? The background of the liver can change in its appearance, and that fatty deposition can be from numerous causes. Sometimes that helps us, sometimes that hinders us. Now we're switching to a different kingdom. And I think I'll switch over to this side. We're in the tropics, near the equator. Sunrise. And I'll show you a few more examples so you can kind of get your bearings. This is it, or the site, when, I guess, during kind of approximately noonish, and you can see this very elegant temple with multiple spires. Originally there were 5, now there's only 3. And there's a huge walkway on either side. It's like a moat that fills up during the monsoon season. So a few more cases. And this is to illustrate perhaps what MR can bring to the table in terms of imaging. Oh, sure. There. Is that better? Can people... I'm soft-spoken, so that... And I'm also vertically challenged. That doesn't help. This 55-year-old patient underwent MR, and it was for... to better assess the metastatic disease. There was more METs picked up with MR rather than CT. And just to illustrate the fact, again, that these lesions pick up the contrast very quickly, unlike some other metastatic disease. And they don't necessarily all pick it up uniformly, as you can see. And there's an example of how quickly these lesions can wash out and be lost in the background of the liver. Again, this patient had a mesenteric mass. So again, you can see several features that we look for as imagers to help make the diagnosis of carcinoid and also to assess the metastatic disease. Ultrasound is used, but as I mentioned, can have some limitations, and it's often left to CT and MR to follow patients. I should mention that ultrasound has one advantage, and that is that we can assess flow within hepatic and portal veins. Sometimes that becomes very important, and looking for thrombosis, and that is one advantage that ultrasound definitely has. Getting back to that tropical kingdom, and famous stone carving in the temples. Just going to quickly wrap up in terms of another case, just to show you that not all carcinoids are in the right lower quadrant and have a mesenteric mass. This patient had their primary tumor in the pancreas. And as you can see, there was multiple lesions in the liver. Patient also had an MR, and this is done without radiation. It's done within a magnet and using radiofrequency to get the images. It often allows us to have better soft tissue contrast to look at particularly the liver. You can see how well some of these lesions stand out and how there are multiple small ones. And just to finish up, often MR and CT are complementary. We often reserve MR for problem solving. So I would say in terms of particularly carcinoid tumors, the main imaging is through CT. And so I'm not sure if people have been able to figure out the two Buddhist kingdoms. The last one we were talking about is Kingdom of Cambodia, and the images I guess I displayed are from Angkor Wat, which is a famous temple site. And initially, the kingdom in the Himalayas is the Kingdom of Bhutan, which has recently become, yes, obviously some people knew that, yeah, and it has recently become a democracy. So thank you very much for your attention and for the opportunity to speak at this meeting.